Hello, good afternoon, everybody. Dr. Barry again, your internist, board certified as always, founder of drpierresblog.com, author, speaker, soon to be podcaster, bringing you another edition of this week's Lunch and Learn. Started a little bit early today. Got a few things to handle during lunch. See some patients in the hospital. So I definitely wanted to, again, continue our kickoff with heart disease. First and foremost, I want to give a shout out to all of my replay viewers. Again, I always make sure I shout out my replay viewers because I know, the times I do these, you don't get a chance to watch me while we're doing it live. You don't get to ask questions while we're doing it live. But just remember, I do continue to follow these questions, and I always post these videos on my blog as well. So if you have any questions, concerns, go to the blog, ask the question, and I'll make sure we answer it there. Today we're talking about stroke. Again, we're just kind of keeping up with our theme of Heart Disease Month. The month of February is Heart Disease Month, as well as teen domestic violence. So last week, if you didn't get a chance, catch up on last week's on last Thursday's Lunch and Learn. We talked about domestic violence, kind of signs of recognizing that, and we also gave some unfortunate facts about teen dating violence as well. But today we're talking about strokes, and the way I like to really explain to my patients what strokes are. Think of them as heart attacks, but in the brain. When we have our heart attack, we're concerned about blockages or anything in the heart, and that stops blood flow. And so I like to tell my patients to kind of think of it in that same premise when we're thinking about the brain. In regards to heart attacks. So, and stroke can be very debilitating. If any of you have any family members or know any, friends of family members who are dealing with strokes, it is definitely something that could be chronic, definitely something that could be lifelong. So it is definitely something, we like to try to, preemptively prevent as if we can. And there's a lot of risk factors when we talk about strokes. And you've heard me probably talk about this this whole month ad nauseum. We know smoking is a risk factor. We know high blood pressure is a risk factor. We know diabetes is a risk factor. We know age is a risk factor. We know family history is a risk factor. So we have a lot of risk factors. High cholesterol is another one, a risk factor as well. And that's just like the main ones. Where there's a lot of autoimmune diseases. There are a lot of hematological issues kind of associated with strokes as well. That can play a huge factor. But those are the big ones. When we think about strokes, we're thinking about blood pressure. We're thinking about diabetes. We're thinking about high cholesterol. We're thinking about family history. We're thinking about our cigarette smokers. Again, why are they smoking a cigarette? We don't know, but we're thinking about them as well as far as the risk for developing a stroke. In that regard. So when we talk about stroke, I think the 4 letters we like to tell all our patients that think about the word FAST, FAST, when we're thinking about strokes. So starting out, and we like to almost go in that order. When we're kind of deciding, do I need to call ambulance? Do I need to go seek medical help? When we start with FAST, we start with F. So we have facial drooping. Facial drooping is a very common sign that we see in patients, or something that we see in patients who are developing a stroke. So and you just obvious that you'll just tell them to smile, and you'll tell an obvious difference in the shape of their smile, an obvious difference in the way their whole face kind of droops over, almost like this melting off, where they literally can't physically raise their mouth to smile. So definitely, so when we first FAST, F, facial drooping is a big one. When we talk about A, we go into arm weakness. Arm weakness is, arm weakness is an important one. I do have patients who get strokes who just affect the lower extremities, especially because we know when we talk about strokes, depending on where the stroke happens in the brain, tells us which part of the body is infected. And then in that reverse sensation, if I see a person who has a right-sided stroke, who's affected the right arm and leg, I know that their stroke was on the left side, and then kind of vice versa, just the way our the blood vessels in our brain works, and like which ones they kind of innervate. So our second one is A. So A for arm weakness. So, and I always like to extend this, even though it's arm, think about leg as well. So when you have extremity weakness, that can be a sign of concerning for a stroke-like symptom. So definitely extremity weakness, especially the arm. S for speech difficulty. So if you start noticing a patient or a friend, a family member starts having difficulty speaking, whether they're drooling, whether they're mumbling their words, that can be of concern for stroke-like symptoms. And then T is pretty much it's time to call 911. Because if you get into the point where they have the F, they have the facial drooping, they have the A, they have some arm weakness or leg weakness, they have S, they have some speech difficulty, and it doesn't have to be all three. They can have 1, 2, or 3. Most of the time they do have a combination of the 3. If you see those symptoms, they're definitely time to call 911 to get some help. In that regards, because again, especially when it comes to stroke, the sooner they can see a physician, sooner they can seek medical professional help, the more likely are they, one, to survive, because depending on where the stroke is, this can be life-threatening. 2, it can help us, treat the problem much quicker. Let's say if their blood pressure is 200 over 100, and they're having a stroke because of that, getting them to seek, getting them in the ER as quick as possible is enough to, bring that blood pressure down and make sure that they don't have chronic symptoms moving forward. And then I just want to kind of give some other very more or less common symptoms, but then definitely symptoms that we should always be concerned about. We talked about the weakness of pretty much, and that kind of fell under A as far as weakness of any part of the body. Numbness or pins and needles feeling, as well as definitely a concerning sign or symptom for a patient dealing with a possible stroke. Trouble walking, gait disturbances. Again, if they're just kind of off balance. Because this, depending on where the stroke is, it may not give you facial drooping, it may not give you speech difficulty, it may not give you arm weakness, but maybe all of a sudden you really can't walk how you normally walk, or you notice your grandma, your grandpa, mom, dad, and again, I definitely talk a lot about them because this is usually age related. Usually the older you are, the at a higher risk you are to get these strokes. Not to say that my young patients can't get it, because I know my young folks watching, you guys think y'all invincible. Y'all not. But the more likely scenario is that you're older. Your mom, your dad, uncles, grandma, grandpa is more likely going to suffer from a stroke than you do. We talked about the blurred vision, dizziness, headaches. Sometimes they're confused. They don't really know what's happening, what's going on with the situation. Sometimes they just act differently. Their behavior, their mood changes. Sometimes, their eyes. Their eyes is a big one. Difficulty like kind of tracking their eyes. Difficulty like visualizing things can usually kind of associated along with the blurry vision, and just depending on, again, where the stroke is at. Muscle stiffness as well. So definitely a lot of signs and symptoms that we should definitely be concerned about when we're thinking about, are you having a stroke? Is mom and dad having a stroke? And it's definitely something that, especially from a medical professional, I see patients in the hospital, as well as patients in my outpatient clinic here. And I've seen them on both ends. I've seen patients, right when we get them inside a hospital and we're able to control the blood pressure and we're able to make it so that they don't have, the paralysis. So they don't have, needing someone to kind of help them, bathe and all these things here. And I've seen them on the other end where, we're able to get them, we're able to treat them soon enough where they have zero symptoms. And the big thing, especially from a primary care standpoint, when we're dealing with our patients who have high blood pressure, when we're dealing with our patients who have diabetes, when we're dealing with our patients who smoke, when we're dealing with our patients with high cholesterol, these are some of the things, we're trying to, save them from, especially with my younger patients, they, because they're invincible, because y'all invincible, they tend not to worry about a lot of the, the end stage problems that can occur. And, and medicine these days is amazing, right? So in the old times, you may have had a stroke and, that may have been it for you. You may have been, dead from that stroke. Not pretty much not anymore. These days, we do a very good job at keeping you guys alive who suffer from strokes. So if you know a patient, or you had a friend or family member who's had a stroke, and you notice that again they probably can't use their left side, their arm is really constricted here, they can't move, because that's what happens. Because once you have a stroke to a certain part of the body, and that body isn't getting any signals from the brain to move, your body will naturally contract. So it'll naturally contract up. It will naturally, be weak, and the muscles will atrophy. So there's a lot of things that, as a primary care physician, I'm trying to prevent to happen in my patients, because I know that if all it takes is me, getting you on the right medication early, and we don't have to deal with any of these problems. So again, this is, Dr. Barry, board certified internist. I am your founder at drpsblog.com. Tomorrow we'll be having, I'll write a post up about this video, and again, thank you for my replay viewers who's going to catch this later on today. And so we're going to do a Facebook, and then I'll post this as video as well too, for everyone who follows me on my different social media outlets, YouTube, Twitter, LinkedIn. I got people who are everywhere who tend not to really catch me live, and that's okay. If you got any questions, concerns, always leave it in the comments wherever you see the video at. If you see it on LinkedIn, leave it in the comment. If you see it on Twitter, if you see it on my personal page, drpsblog.com, leave a comment as well, and I'll definitely be glad to answer that. You guys, like I said, I did have to start a little early, so I'm gonna run. I want you guys to have a great, blessed day. Again, these are signs and symptoms. They're very easy to prevent. You guys with the moms, dad, your grandparents, your aunts and uncles, get on them. Get on them to make sure they're seeing a doctor. Get on them to make sure they're taking their medication, because there are real consequences for not doing so. So again, if you haven't had a chance, go ahead and check out drpsblog.com. Go ahead and get on the list. And I'm also working on a Facebook group as well, because I'm going to be giving a little bit more detail later on. But I'm definitely working on a Facebook group as well to, get more personalized with all of the people who are always watching me on the Facebook Lives, and who are just following me in general, to kind of give you guys a little bit extra that I really can't give for my Facebook Lives. Hey, Amanda, thank you for watching. I talked about stroke symptoms today. So you guys have a great, blessed day. I got to go. Talk to you later. Bye.